Hi, everybody. Welcome to Body Sync Bytes. I'm here today with my client and friend, Lauren. She is here to help me kind of talk about her journey to health. She's a cancer survivor, and she found me in her journey to navigate the path to healing post-surgery and post doctor's orders, I guess I should say. Mm-hmm. Yeah. So with that, Lauren found me after your first reconstructive surgery.
Yes.
And I'll kind of let you tell us a little bit about you and your story and how you found me.
Okay. Well, thank you for having me.
Yes.
First of all, I'm super glad to be here.
Thanks for accepting my offer.
Of course. Yes. So I found Chris, thankfully so, because I had never had a massage, by the way, in all my 37 years of life, not one massage. And when I went in to see her, I was like, what have I been missing my entire existence? It was like definitely changed my life, to be honest. I don't want to start crying too soon, but yes, life-changing. So I found Chris because, like she said, I had gone through breast cancer at age 37. I did early screening actually because my mom had breast cancer. And so I was just advocating for myself, just really trying to catch it if it was there. And I'm very glad I did, obviously, because we did catch that when that tumor was pretty small. But I found that cancer. I went through the chemo, was supposed to have a lumpectomy, which would have preserved, obviously most of my breasts, but ended up needing to do the double mastectomy. So I had a surgeon, Dr. He's one of the best here in San Diego, so they say. And I think it was my first post-op. From that, he gave me her card and said, this can be something that helps. One of the things that people are concerned about after this type of surgery is lymphedema. And so this can just help with swelling. This can help with your recovery process. So I called her and we kind of, scheduled it out. It's funny because in my mind, when I heard lymphatic drainage massage, I was thinking she was going to be draining something out of me. And I remember you, a couple weeks ago said, someone came in and they thought I was going to drain fluid from their body. Isn't that funny? And I was like, yeah, so
that was
funny. You. I was there too. So when I went in for my first session with you, I just was so surprised at how, wonderful it was. And I did feel better instantly. I feel like I'm kind of just going down the road with this story, but basically that's how I found you, right? Was that the doctor suggested it. And I've been going back ideally weekly, but sometimes every other week since then. And so it's been about, I want to say over 6 months, I think. I've had several reconstruction surgeries since that first mastectomy. So it's like hard I kind of lose count on like which surgery I'm on and how long ago it was. But yes, very thankful to have found you. It's definitely been just such a huge part of my healing journey.
Yeah, the thing that I was super surprised about is I had worked on several clients of Dr. And he's got a nurse practitioner. Maybe it's just his nurse that has become my advocate. I think she works a lot with people after he does the surgery. I think she's there to facilitate a lot of the recovery side of what he does.
Yes, she does.
And I think she's gotten a lot of feedback from her clients that I was a benefit. And so then she started to refer to me.
Yes.
And I've actually gone down and met her and asked her lots of questions. And we can kind of get into that too, because I really do want to be an expert for people who are post-recovery or just on that journey of like, okay, I had this happen, I had to have a surgery, and how do I best recover from that? And then move on with my life, hoping that never happens again, right?
Yep.
So the main thing was a lot of inflammation, I remember, and that's something that I don't think that the doctors properly prepare people undergoing any kind of surgery, how much inflammation is going to be there.
Correct. Yeah. I mean, I could probably talk for hours about the things that I wasn't prepared for, and just depending on which surgery we're talking about. But overall, there's just I didn't have enough information. And to be honest, I don't think I had enough information to accurately decide which type of surgery I wanted to have. There's not a whole lot, like you say, when you talk about preparing people for something like this, there's not a whole lot of, this is what's going to happen afterward, or here are the possible things, the roads that this could lead to, or the obstacles that we could face. For example, there's, one type of surgery after you have a double mastectomy where you can have, it's called DIEP, flap surgery. And so that's where they would take fat from another part of your body and they would attach it to you, right? And you would have like breasts made of your own tissue. And I asked about that. I asked Dr. about that, and he just said, no, it's not a good option for you. Implants are what we need to do. And I think when a woman is going through chemo and maybe radiation, you just trust your doctor.
Yes.
In hindsight, I probably should have stuck with what my gut told me in that moment. And I think I should have gone for the other surgery. Because implants to me, and with the research I've done after, right? And it's kind of like, you do a bunch of research, you find out you kind of maybe should have taken another path. But I just wasn't given the full scope of options, I feel like I was heavily pushed in one direction.
And that's protocol. That's Western medical protocol. I mean, that's
right.
To simplify and make things easy and have everybody fit into the same little, like, oh, you've got this, you're going to go here. Oh, you've got this, you're going to go here. So that's part of just how they're trained.
Right.
Unless they're doing, and it's great, we do make doctors do continuing education. And so then you're at the whim of what courses they choose to deepen their own medical practice.
Correct, yeah.
So they're only as good as what they've been required to do or what they're impassioned to do.
Yeah.
So he may or may not have known about all of these other surgeries that were of offer to you because that was the one that he did, and that is the one that he's good at, and that's the one that he has been doing for years and figured would be best for you.
Yeah.
That's just kind of what his protocol was. And that's not wrong, and I'm sure that he's helping a lot of women.
Yes.
But today we've got
There's
options, and we've got the internet, and part of why I wanted to do this podcast and why I wanted to kind of put what I know out there is specifically for this, is that so much of this information comes to people when they find a practitioner like me.
Yes.
And you're in the situation where you're like, I don't know what to do next.
Yep.
And I'm like, oh, well, if you would have come to me before, we would have.
Yes.
So I'm trying to get that message out a little bit more. So I think that the choices that you've made were the best choices that you could have possibly made in a very stressful situation.
Yes, at the time.
This is not just your decision to make. You've got a husband, you've got children, you've got lots of people participating in these decisions. They aren't just uniquely yours. So to be back into your life, I think you probably made the best decisions in the moment. And I think that whatever decisions you make in the future, the good thing is you can make those different decisions.
Right.
Like nothing you've done so far is irreversible.
Right. It's not too far gone.
Not too far gone.
Right.
So,
yes.
And you've healed well.
Yeah.
And I feel like you've really owned that process and been open to changing lifestyle, like probably more dynamic than any other client that I've come across.
That's good to hear. I definitely did, with this whole journey. And it's funny because talking with you, I already had those seeds planted, right? But when we're in the room, we're just talking about, oh, did you hear about these new sandals that are good for your feet and they're natural? Or did you try this dentist? And what about these chips? Right? It's just all of these lifestyle changes that just need to happen.
Yes.
And I think, obviously nobody wants to go through cancer and multiple surgeries, but the one good thing that came out of it is now I have this new outlook where I'm like, I'm going to live a more natural life, right? And we just swap stories about have you heard about this? Have you heard about, here's this information. So not only have you been helpful in that healing process for me, because again, it's turned out pretty well, I think, considering what I've been through, because of your services. Definitely, I just know that it's made such a difference.
Yeah.
So not only just the services and the massage and healing better because of that, and also I just feel like I feel happier, right? Like when we get the stuff, I can't even begin to explain what it would be. You're the expert on that. But like, just like you say, the inflammation, and when you press on my back in that certain way and you're like, oh, what's going on right here? I just feel like it also impacts my mood, right? Just how I think about everything and how I feel too. So it's not just the healing. It's just so much more than that.
Yeah. And I want to always give it back to my clients, because if you weren't open to that healing space, there's nothing I could do to make you go there. So it is an openness that somebody has to come with, that to allow there to be something different afterwards.
Yes.
Right. And I mean, belief is powerful, but I mean, there's something physical happening. I mean, I don't want to get too airy-fairy about it, because I mean, that's where I was trained, and I can believe about that all day long. But I just feel like in a very practical sense, like there is an exchange of fluid and oxygen and nutrients in the body. And when you're in an inflamed state, and when you're tired, and when you're in recovery, having that facilitation is just a benefit. Yes. It just does what you can't do on your own.
Correct.
And it's very physical. Like it's very real. Like, so I know that there's maybe an emotional or another essence to it, but ultimately it's a physical thing, and it's duplicatable and repeatable. And, you know, I think that that is why they're starting to train it in medical school, or to tell people that, hey, there are people who do these things that you could refer to that would benefit your clients. I feel like I have not been in those courses, so I don't know what the real language is, but I know when it first started to come to me, I'm like, I feel like he said, oh, go get lymphatic drainage, and had no idea what it was. Yeah. Right. Right. I feel like working with, has referred you to me, and that office, I feel like they have a little bit better idea of what it's going to do for their clients, and how it facilitates that healing process, how it keeps the healing happening, where where people do get to that stage where they feel like, okay, now I feel the inflammation going away, and I hit that point. So I do think that, I mean, it is all of those things.
It's all of that,
Yeah, to feel that comfort. So for you, being that, one of the things I like, and I'm kind of coached into doing, is to try to get people to come to me before they have all these procedures. Yes. And that's a little bit of a shaky ground. I think, I don't know if I'll get the buy-in from the plastic surgeon on that one, because the chances that I could talk somebody out of a really money-making procedure, you know, again, yours weren't elective, but I know that Dr. and other plastic surgeons do a lot of elective surgeries. Yes. I know for sure I've deterred 2.
Okay. Yeah, they probably don't love that.
They probably don't love that. Yeah. But I do.
Yeah, I do too.
Because the couple that one was a nurse. Actually, both of them were caregivers who I just let them know that if they were planning to go back to work after 2 weeks after a liposuction, that there was very limited chance of that being true. Right. Now, they can do very, very, you know, kind of just cosmetic liposuction procedures that maybe people can go back into 2 weeks and do like a normal lifestyle. But these people were taking off a significant amount of fat tissue from truncal obesity, and thinking that they were going to function in 2 weeks. And I was letting them know, like, you can't be an ICU nurse and think that you're going to go be on your feet for a 12-hour shift right after. You know, you're just not. And the other one was caring for like a 90-year-old she was going to have to lift him in and out of a bed.
Oh, no.
And the surgeons were not questioning whether or not the surgery would be exceptional for them. They were definitely saying, oh yeah, you know, you need to do this. So my coaching was to them, like, just humor me and find people that will back you up. And if you have to call them off, great. So I'm fine. I don't need you to help. Yes. But I told one that I said, I don't think that you're the kind of person that's going to go and ask for help, and then you're not going to help yourself through your recovery, because you're going to be trying to do more than you should ever have. But you weren't planning right. So again, I don't know if she went back to the surgeon and said, oh, I talked to Christina.
She said, don't do it. It's possible.
But that would be kind of what I want to get out from this podcast, is to just tell people, like, if you're going to take on in this healing journey, look at it from the beginning to the end. And if you can meet the practitioner that's going to be with you afterwards, before, I feel like it suits a lot of different purposes. It'll suit the purpose that you're going to be more comfortable when you come to see them the first time.
Correct.
It gives me the advantage to be able to say, like, I get the question all the time, oh, am I swollen? And if I've never seen this person before, ever, how am I going to answer that question?
Exactly. That is so true, because, you know, if you could have felt how my stuff was before, right? You have such a better grasp on where I'm at after the surgery. So I think 1000% I would recommend to anyone to go pre-op to you, right? Feel them out, see where the inflammation is and how things are going just at a baseline, right?
Yes.
And that way you can know how things are going, truly know, right? And give them some feedback post-surgery.
Yeah.
Yes, for lipo. So I did some lipo. I needed to have fat from my hips, I believe it was, and put into my chest. And it is not easy. And so many people just minimize that surgery. But, you know, even today, it's pretty numb. And we're talking about like almost a year. It feels odd. I mean, I won't lie. I like that my love handles are gone. Okay? I do like that. But I just wasn't prepared for the numbness. And I definitely wasn't prepared for the length of time, like you say. You know, if anyone's planning to go back to work a couple days after lipo or even a week, not going to happen. I was just totally bedridden, at least for, I would say, 1 full week. The second week, my husband had to be there to, you know, help me reach things. You're just not going to want to be doing, in terms of healing, you don't want to be going back to work probably unless you have a good full 2 weeks at least, right? And then depending on the level of the, like you said, if someone had that truncal obesity and we're doing a lot of liposuction, for me, it was just a very small amount. And I still needed a really good, solid recovery plan with someone there to help me. Yeah. Right. It's not something that I would have ever done just me on my own with no assistance.
Yeah. And yeah, I mean, that's a lot. I mean, and just the amount of surgeries, you're so brave and courageous.
Thank you. Kind of had no choice, but yes, we do what we need to do, right? We're strong women.
It's still a lot. And I just want to acknowledge that because it is. And I don't want to downplay what that looks like.
Right. I don't think anyone should be downplaying.
It's like in bed, not moving, trying to find a comfortable position.
Yes.
Whether it was elective or whether it's necessary. Yeah. Right. That is not a nice place to be, and to not know how long it's going to last and if the things you're experiencing are normal. Yeah. And I think that the doctors once their job's done, cutting you open and stitching you closed, they're kind of done with the job. And one of my things to advocate for this is to help people have the right questions, like you were saying, to go to the surgeon and say, the thing that we've found is what dissolves and what doesn't, to really know what they're putting in the body or taking out. I know you had a little scare post the second surgery that there was an area that wasn't feeling right. And together you did all the right things. You felt it. Yeah. You asked the right questions. Yeah. You had the diagnostics done. And all along, all I could do is be like, no, it just feels like something they put in there.
Yes. And that was such a huge relief to hear that from you, because you feel so many things, right? Like, and my doctors are so irritated with me, but I'm like, if it's something that I need to be concerned about, we need to know, right? So, but like I said, you kind of feeling that and saying, I really just think it's something like they injected the fat, right? Or it's a suture.
Yeah, or a scarring from the lipo, or just the mesh, or
so many things it could be.
A staple or a dissolving stitch that isn't dissolving. I mean, I've gone down the deep holes with all of that. And I can get as much of the information as that they're not asking the right questions even on the internet. So
right. Asking the questions is key, right? If you don't know what to ask, like I sadly had a breast augmentation when I was 25, and I was not very smart. I will admit to do that, because I look at pictures and I'm like, I would just long for my natural body so badly right now. But I didn't know to ask about breastfeeding, right? I couldn't breastfeed either one of my kids. which was devastating. And I should have done my research, right? But I'm like, everybody's getting boob jobs. Let's go get one. So I just kind of followed the crowd with that. And I didn't have, it didn't ask the right questions, and the information wasn't offered. But that is a huge regret that I have, that I did that, right? Because breastfeeding is such an important part of motherhood. And so that
if you had had the information, you may have made different choices.
I want to say I would have.
But it was such a trend, like as I was thinking about this, there was this time where all I saw was tons of boob jobs. And then then I got into where everything was BBL and lipo. And now it's it's more fat transplant, even more.
Yeah.
And I don't know if the research is all in on all of that.
Probably not.
And these surgeons are so willing to do these procedures. And I feel like so much of it is trendy. Yeah. And all of my clients don't have Kardashian money to have their butts big and then to have them small.
We can't flip-flop, right? As much as the Kardashians.
Not how it's done. It's not how the real body. It's not how the real bodies I see every day are doing it. And what's scaring me is that there's this whole healing thing after each of those that they aren't showing.
Right.
That's not what's popular. And even when the boob jobs were popular, they weren't fully disclosing all of the information that may or may not happen, Right. Like you might need multiple surgeries. Like they don't last forever. I had an esthetician in my practice that was going through having had hers for that limited amount of time, and she was having to have a second surgery, and then having to think that she was going to in another 20 years have another her having that breast augmentation meant multiple surgeries throughout her life, right? Yeah. So those things we know now. I don't see as much of it, although now I see more like the breast reduction. I see a lot of that.
Yep.
I was watching some videos just on the complications that I see and how normal they are. And I want to investigate all the ways to make those better that I don't think are being tapped into, because there's nobody on that healing side,
Right. Yeah. It's kind of like, let's get you in here. We're going to make you perfect. You're going to get, all the looks that you want. You're going to have that perfect body, but we need to let them know this is what it looks like and this is what it might look like, right? One thing with my reconstruction was that there's that inframammary crease, right? So my implants now are not up where they're supposed to be because that crease was damaged. And nowhere in my journey did any surgeon ever say, of course, I'm sure it's in the fine print, but no one said, hey, the crease can get damaged with this many surgeries. You may lose your crease, which means your boobs are not going to stay up.
And I had never even heard about that until you shared this with me. And the only way you found out about it was going
online,
down the rabbit hole, searching for how could this have happened? How could I have had my second reconstructive breast surgery and my breasts still aren't staying where they should?
Yeah.
I didn't even know, even being a body worker, that there was this crease that holds the girls up versus letting them fall down.
It's got to hold them up. Yeah.
And so now I have broken, then you have to have a special reconstructive surgery to allow the breasts to stay where they should be normally.
Yeah, which may or may not work.
Yeah. But you did come across a clinic that specifically
they do specialize
did this specialty to repair these damages.
Got to go to New Orleans if I want to do that. And if I don't do that, I wear a padded bra 24/7. Because if I don't, they're like, oh, there they go. And it's, I'm like, well, maybe at this age I'd be wearing a padded bra 24/7 anyways. But I don't like that feeling of not being comfortable to take it off.
Yeah.
It's sad to me.
Yeah. And then the unknowns, right? We don't know if this was natural. We don't know if it was the first surgeon that made this mistake. We don't know if it was the second surgeon that didn't want to out the first surgeon. We don't know if he made and then didn't want to tell you about it and did a second surgery. I mean, but I just, you've been through a lot to try to get that repaired, and I'll have no choice of your own except for to try to just normalize after the whole process.
Yeah. So, I'm just going to move forward, make do with what I got, keep with my massages so that, everything stays as healthy as it possibly can. But at that point, you just kind of have to move forward.
And the thing I want to acknowledge and the privilege that I get is just how much things just keep healing and changing. Yeah. Like even when we feel it's good, I feel like the next time I see you, it's kind of even better.
Right.
And I think that's a big attest to that you're caring for yourself and that you are engaged in this. Like we've talked about getting rid of trans fats in our diets.
Yes.
You shared with me about the boulder chips that are cooked in an olive oil, rather than a trans fat or a safflower oil. And so we've, that was kind of my dedication last year. I was doing that, and as one of my mini changes, MINI, mini, because I feel like if we do a lot of those little things, eventually they're kind of what you're doing every day.
Yeah.
So that was things that we've talked about. And again, we're not doing it religiously and every single day, but what we're bringing into our homes, we're making a conscious thought of that, and conscious thought about what we're having. It's not that they can't have a potato chip if we're out at the store, or if the sandwich comes with them, that's fine. But the ones that we're going to buy to serve with our sandwiches at home are the bread's going to be preservative free, and the chips are going to be non-trans fats, and and again, we can move away from snack foods and all these things, but we live in a real world where we're bombarded with these things. The best thing that we can do is make healthier choices to still fit those niches that we can feel normal.
Yeah. And that would be something too, like if you could get someone pre-surgery, right?
Yes.
Because I would never say, go get liposuction if you're still eating a bunch of processed foods, right? And let's see how your body does if you cut out some of these chemicals and all these, like the bad fats and the oils that we're talking about. Try that first.
Right.
Give yourself 6 months of eating a clean diet. And again, I probably eat more like calories and yummy food and fat now than I did before. A lot of the fat-free foods and sugar-free foods, they may be low in sugar, low in fat, but they got, all the added chemicals of processed stuff. So I eat better now. Like it tastes better to me than before. So I would just say, try this and then see how your body responds. You may not need to do a bunch of lipo. Right?
Yeah. Well, it scared me.
Right.
I mean, that's my pain to where I am now. I watched women come in and wanting to do these liposuction procedures, and I was like, okay. And as I was getting bigger and bigger, I'm like, okay, I either got to do it through diet and exercise, or I'm going to do a lipo procedure. And then I considered the cost of what a lipo procedure, and I figured, well, with that money, I can really dedicate some time to a medical professional and some supplements and really be accountable. So I spent the money there, and I was able, I haven't hit all of my goals yet, but I was lucky enough to have the metabolism that I was able to shift that dietary intake and increase my exercise, and I got a result. Now, was it easy? No. Did I have to be super accountable? Yeah.
Right.
I hired a professional because when I started doing it my way, again, it wasn't working. And then to have to go to somebody to say it wasn't working and then have him say, oh, well, were you doing it your way?
Right.
Did you follow the plan? So that accountability was what made it work for me. I understand that's not for everybody, but I like to think, again, I like to practice what I preach.
Yes.
If I wasn't able to do that, that would be my story too.
Yeah.
That's where I'm real.
Right.
So that's what I could offer you and say, hey, all I know is I found that this worked.
Right.
And give it a try. What if we drink more water? What if we're not drinking enough water? Let's put a cup of tea in our afternoon.
Exactly.
Like we talked about.
Had that conversation. I've been drinking my tea.
And it didn't have to be the best tea. It didn't have to be like the organic tea. It just whatever tea was in your cabinet, I found all this tea in my cabinet. I'm like, obviously, I think this is a good idea because I've bought it 100 times.
It's here.
But that adds more water. It adds all the herbal essences, all the prebiotics, all the things that tea can offer you in an herbal form. So just like I said, the many little changes that you make throughout the day, brings it back to a healthier state, we'd like to think. And then add like lymphatic drainage therapy and add somebody who you can be accountable to and who then can support you and say, I don't think that's worth it. I could give you that feedback. Like you were just trying too hard on that point and you're not getting the benefit that you were looking for there. So you get that, literal feedback from somebody who's touching your body. And
it's so important.
That's the value I like to be able to give.
Yeah, 100%. I would never let go of that now. Like once I'm in, I'm never going back.
So I like to think that's how I've stayed in practice for so long, Yeah. And one of the things that I'd like to invite anybody who does hear this podcast and has seen me over the years, I would love a comment in the comment section as to where you met me and how you know me and yeah, because I've practiced a lot of places. I feel like I've touched a lot of lives, and those kinds of feedback, I think those stories are key. I think the stories are what other people can relate to.
Mm-hmm.
I think the stories are why I've wanted to do this. I feel like I'm here to tell those stories, and hopefully they resonate with people, and they can hear like, oh, those people did that and they got a healthy response, and they were able to put the right people in their lives and have the right relationships and get the right information, and they were able to have a healthy outcome. Yeah. So that's where I feel like this kind of happens naturally once you find that right practitioner.
Yes,
right?
100%. And it's not to say that you're going to be convincing everyone, don't do, your surgery. Because there are some people that here's the thing, if you know what you're looking at and you say, okay, I know what my recovery is going to be like. I know what the possible outcomes are. I know that there's a possibility that this might not go well. I still want to do it. That's great. And you'll be there to help them with their healing.
Absolutely.
But I think the good part of what you bring is like the realness, right? Like you said, I want to be real. I want to be honest. And sometimes, and I'm not calling any doctor out in particular or doctors in general, but sometimes they just either they don't have time or they don't realize themselves because like you said, they're not on the other end of it a lot of the times. They stitched me up and I went on my way. And so they are not giving that full picture. And so what you do bring is the realness, just being open and saying, hey, this could be what you're looking at. Just please be aware, make that informed decision.
Yeah. And because everybody's situation is different.
Yes.
Everybody's like you had your family to consider, maybe if you were single, you would have made different choices. Maybe you would have had resources to do something completely different, right? Yeah. Like everybody's financial situation is going to be someplace. Everybody's geographical, what they have accessible to them as these resources is going to be a consideration. Yeah. But I feel like if they can find a massage therapist or somebody who's in a holistic space to kind of have these discussions about what they know before just going a medical avenue, I think is worth that conversation.
Definitely worth it.
So anything else that you want to add coming out of this about lymphatic drainage or anything that you want people to know?
Yeah. I would just say be aware that you're going to feel wonderful. And it just, there's no draining involved.
Oh, yes.
Right? You're just moving stuff around, right? And no lymphedema for me so far. And I would say, again, I'm healing very well considering that like my inframammary crease was damaged and I've had multiple surgeries, but it's probably as good as it could be, I think. And definitely you are a huge part of that. Like there's just no question for me that what you do was just a huge part of that. And I'm just going to continue to go. So again, I think for me, the main point is be aware what you're getting into. I think I agree. I would love if more doctors would send people to you because you can get a feel for what's going on and then you'll have better feedback after the surgery. And just kind of being open to, well, if I want to get this surgery, let's say it's elective, I want to have a conversation first. Let me lay out what it's going to look like. And maybe there's something to try first. Yeah. Maybe, right? Maybe not. But I think just having that dialogue and having some good, honest feedback is just so needed right now. Conversations. Yeah.
And that's where I wanted to bring it back into our community with the practitioners that we are actually going to be seeing when we're referred in our managed care networks to these guys that are, and then what other opportunities are available. So, well, I really thank you for sharing your story and for helping people understand like maybe what they would be getting coming to a lymphatic drainage therapist. Yes. Yeah. No actual drainage happening. Nope. It's all internal. It's all the lymph system. It's all now you will see online, they do have videos of draining stuff out of people's bodies, but I think it's really in Florida and it's not practiced here.
Yeah, I've never seen it.
I've had people not want to come to me because I'm not doing what's on YouTube. But again, this is the method that I practice is Vodner, and it's a slow lymphatic drainage technique. And when they say drainage, it's draining into the lymph channels.
Right. You're just moving
the fluids,
moving it around
underneath the skin,
helping it go where it needs to go.
And it can be done clothed, and it can be done. I prefer to use oil.
Yeah.
I use a really good coconut oil, but
love
it
it.
can be done. It can be done totally clothed too. So I wouldn't want that to be a reason why somebody wouldn't come if they weren't comfortable getting undressed, or if they hadn't had a massage. Like you had never had a massage.
Yeah.
So if you hadn't ever had a massage and you weren't comfortable with being undressed, again, everything's done with professional draping and everything like that. But
it's wonderful.
you can. Those are just for people's comfort levels. I just like to let them know that there is a range of therapy that they can choose from. That's all touch and that can all facilitate and have the same end result.
Yes.
So,
For me, I'm like, I'll take all the clothes, give me all the oil. I love it. But yes, if depending on your comfort level, for sure.
So, well, thank you again for being here today.
Thanks for having me.
And sharing your story. And I think that'll wrap it up for our Body Sync Bites.